Question that has been frequently asked: can stress cause reduction in milk production, or it does not occur? And is stress a factor, or not getting enough support, that is when you're on your postpartum period, a factor that can lead for you to produce either less milk or no milk at all? I'm going to debunk all these myths about breastfeeding, but above all, today's video concentrates more on how can I increase my supply, which is what most mothers are concerned about. You don't want to know what is the myth, what is not, but what can you do actively yourself as a woman to be able to enable you to have ample supply so that your baby is well and you're also fine. Hi guys, and welcome back to my channel. It's Dr. Saru Pendo TV, and today the most common question that I've received in my DM, and even people just commenting below on my posts, it's been repeatedly all the time by mothers, especially the ladies who are in the group. And thank you for all the 300k women who have joined our group. I've seen most of you guys now come from Nigeria, South Africa, and of course our Kenyan babes and the Tanzanian ladies who've been following us for a while. And that's the main reason as to why I'm doing this video in English today, so that I can be able to accommodate all of us. So welcome, and let us talk about it. So here are some of the things that have been researched on and actually have also worked for me as a mom on how I can increase my supply of breast milk, or how I can improve my milk production. You see, one of the few things that you have to consider is pregnancy and even the postpartum period, which at times it's considered the fourth trimester. The first 6 weeks can be a very difficult time for a mother or for any woman who's undergoing the same. And it does not mean because you delivered by a C-section, you as a tougher than the one who delivered vaginally, or vice versa. It is just the whole process of giving birth and having to produce a new person altogether and having to take care of them. There was actually a funny meme I read the other day. Motherhood is such like the ghetto, in quotes, that you go to the hospital and come back with a person with no teeth who cries a lot and always have to depend on you for feed, for everything. Basically, you're their sustenance. And because of this, the first thing that has to help you or will help you get milk is ample rest and sleep. I know majority of the women will start commenting and coming at me saying that they don't have enough support to do exactly that, rest and sleep. However, you've heard of this saying that we say all the time as doctors and even as healthcare workers, nurses, your midwife. You'll hear them talk about sleep when the baby sleeps. Sometimes it can be a bit of a challenge, especially when you're a new mom. You put your baby down, they're asleep, you want to start sleeping, you start hearing them making some funny noises, moving in some funny ways, and you're thinking to myself, oh my God, what would happen to my baby? If you've started researching a bit on the internet, you've read about seeds, and you're thinking, what if something happens to my child? But exactly that is the point where you should be able to release the stress, which we're going to talk about it in a bit further in the video. Rest. You don't know how much this rest will help you until when you stop having to produce milk, and then you realize, I need to rest. Sleep and rest amply. When the baby sleeps, try to do a bit of some little work and then rest. If you don't have support, like maybe family support, and if you're in a position where you can actually employ somebody to come and assist you with work, please get that person and let them hold the baby for you while maybe you're doing something, which I'm going to talk about next, which is going to help with improving your supply, which is expressing or pumping when the baby is asleep, or inter-nursing. So immediately you finish breastfeeding, you could wait a bit, or you could just immediately jump into trying to express. What this will do, will give the signal to your brain that you need the constant supply. So where there's demand, supply will just follow. I guess business people understand this. So if there's demand, if the body thinks there's demand for breast milk, ultimately the supply will be there. But if you're sleeping after nursing and you've not tried to express, or not constantly expressing, and then there are those people who naturally have like lots of milk, so they wonder why are people even thinking about getting enough milk. I'm thinking, where can I take this milk? Because it's a lot. Good for you, but for most mothers do struggle, and especially post-CS mothers, mainly because of the healing process that is going on. The trauma, or even vaginal birth could have been traumatic, and here you are trying to heal your body. Your mind is also trying to come to terms with this new thing that is happening. It can bring about you having a low supply. So some of the things that most people ask or want to know about when they're expressing, what is the correct way of expressing? Because it was a challenge for me even with my first child. When I was trying to express, I got really frustrated because I thought, is it me? Is it the pump I bought? Is it that I don't know. I was really getting worn out, and I was thinking I was not doing the best that I could. However, once you be able to learn a bit, you could either get to learn from colleagues, from the internet, and as for you, my viewers, now you're getting to learn it from me. These are some of the tips that I have gathered over time that help while you're expressing, to make sure that you're getting the maximum benefit out of that episode, or that session of expressing your milk. So while pumping or expressing, these are some of the things that will work for you. First, get a place where you're comfortable. Get a comfortable seat, a place where you can be able to relax and be able to be comfortable. If it's your bed, put a pillow behind you so that you don't injure your back or feel any pain, because most women complain of a lot of back pains and general body aches, especially postpartum period. So get a place where it's comfortable. Before you're getting your place and sitting down, make sure you have prepared yourself a snack. Personally, what works for me would be a hot drink. Could be hot cocoa, it could be a hot herbal tea, which we're going to talk about later. And in addition to that, maybe a banana, something like which will give you energy while you're doing it. So you could have the snack first before you start expressing, or you could have it immediately after expressing. But before expressing works best for most of us. Another thing, make sure your nipple is well moisturized. There are nipple creams which you can use to avoid having a painful experience. You see, when you have to express and the nipple is dry, you tend to like pull. So you know the knee is working with suction. So when it's suctioning and trying to suck out the milk and the area is dry, especially if you're from taking a bath, it's going to be a very painful experience and you're not going to like it. And it's going to prevent you from having the letdown experience. The other thing, I saw my grandma used to do this a lot when somebody who I'll not mention in this video used to breastfeed my grandma while she's coming from school. She'd take a warm towel, with warm water or slightly lukewarm water on the hotter side. Place the towel in the water and then try to dab the breast, massage it a bit, and then now try to express. Even with feeding, it helps you clean your breast well. As you're cleaning it, you're also just like giving a light massage to the breast so that you can be able to. That warm, moist massage really does a number. One, it's good because you'll have cleaned your breast. You don't want to put anything in case your area was not very well clean. And the other thing, that warm, moist massage really helps with the letdown. So now that you have applied your moisturizer or you've moistened your nipple well, you have applied the warm, moist towel, you're comfortable, you've had your snack. Do you know how to use the pump correctly? And are those plunges that you're putting in within the right size of your nipple? Because if it's not, then you're going to have a terrible time and you might think that you are the problem, but it could be a pump problem and not necessarily a you problem. So now that we have slept well and we've rested and we're getting support, or we have hired support, which reminds me, I've seen several, I think organizations, or I would say companies, that now are dealing with healthcare workers who can come into your home and assist you with the baby, especially at night while you try to rest or pump, while they take care of your baby as you sleep. But for now, I've not been endorsed by any, so I can't even mention any of them. And I've actually forgotten some of those companies' names. But if they do watch this video and want to do a collaboration, I'm very open for many collaborations this year. Because 2025 is that year, we say it, right? So now, we've slept, we've rested, we pumped, and we have pumped correctly, so we're getting the ample amount of milk that we're supposed to get. Like, this is one of my people who have been following me for a while, and this is what she gets every day in the morning. That is, she wakes up and after nursing the baby, she gets a whole 300 ml of express breast milk. So you see, this is things that actually do work and not things that we're just talking about just for the sake of it. Now, when it comes to eating, you'll pardon me for the people who don't know Kiswahili, but I've been told wamama wenye wananyonyesha wanakula kama watu wa mjengo. That is not correct. You're not eating for two, you're eating for one, yourself, and you're drinking for two, which comes to the fourth point about drinking. You have to always stay hydrated. And the main thing that will keep you hydrated is water, just plain water. You can have it warm, or you can have it room temperature, you can have it cold, whichever way, but stay hydrated. And then of course now you can add on to these teas here and there, but not necessarily having a whole flask of porridge and a whole flask of, I don't know, cocoa, just trying to up the milk. It might not really work for you, and it might end up getting you excess weight, which will end up giving you stress, and then again will have low supply. We don't want that. You just want to drink for two, and mainly water, and eat for one. And when you're eating, make sure you're eating healthy stuff, not just eating everything, the mandazis that are in the house, what are they called? Chapatis, a lot of wheat. And most of the time you find that when you're eating incorrectly, it also affects your baby, and they start having even more exacerbated signs or symptoms of colic, which we're going to discuss in another video. So make sure when you're eating, ensure that you're having high fat or high fat, high protein diets. So for example, you can have oatmeal. My favorite right now is avocado, and of course the oatmeal porridge, and not like you're consistently just drinking porridge throughout the day. You can have porridge right now, and in the morning perhaps as you're having your avocado, then while you're snacking. By the way, before you do your expression, when you want to pump, or rather when you want to express, before you do that, you could have a handful of almond nuts, or whichever nuts of your choice, a glass of warm milk, or warm water, or warm black cocoa, and then now you express. It will do wonders, and you'll tell me about it. I can't wait for you guys to try these tips that I'm giving, so that you can comment down below, how it is working for you guys, right? So yeah, point number 1, 2, 3, 4, 5. Point number 5, actually, now we're on the 5th point. Ensure you're using both breasts. As you've realized in my channel, we normally like to get candid, open, close, and up and personal. And I always talk about my experiences or experiences of some of my clients that have allowed me to share with you guys. This is my own personal experience. When I had my first child, I got very bad nipple cracks. It was on one breast, and it was because of poor latching. And by the way, just necessarily because somebody is a doctor doesn't necessarily mean they'll know how to do it exactly. That's why there are even lactation experts who are not doctors, and there are doctors who are lactation experts, mainly because you might be a doctor and might not really know how to apply that knowledge when you have your own child and how to do it correctly. That's why we keep on having to remind each other on the things that we need to do and how we need to do them. So when I had the cracked nipple, and for this 5th point is use both breasts. So whatever is happening to either of your breasts, or the baby is acting like they don't like this breast, they like this breast, they prefer this one, or you're having a crack, or you're feeling engorged in one, it might be a painful experience, but you have to use both breasts. I thank God my mom had to keep reminding me that you don't want to get further complications of the fact that you're already having engorgement in that breast, secondary to I'm not feeding it. Every time my daughter would wake up, I would literally cry. Literally cry. It was one of those moments where you just didn't know what to do, because I'm feeling pain already. Even as I reminisce about this almost 7, 8 years down the line, it's still a very painful experience, mainly because you don't really know what you're supposed to do, and the baby needs you and they need to feed. But my mom kept on reminding me that you really need to put that baby on that breast as well, because you need both of them to keep on producing, and the cracked nipple will help. And I think I've already spoken about cracked nipples, but if you want another, maybe a short, I'll do about it. But today, let's just up the breast milk, please, because that is the main problem. So yeah, make sure you use both breasts so that we can improve and maximize on the milk production. Higher. The sixth point, nurse frequently. I saw a woman say, oh, my baby sleeps a lot, so I tend to have swollen breast all the time because I don't have a pump, I'm not expressive. But those are excuses, if you ask me, because I think when by the time people are being discharged from hospital, you're told to either feed between 2 to 3 hours, and this is even the baby is asleep, but you know you fed at 12, then 2, the baby is not awake. There's no need to wake the baby at 2, but maximum by 3, if the baby is not awake, you need to wake them up so that you can feed. And again, as we spoke about it, if you feel you're too engorged by the time that is 2 hours after the last feed, do express. And you don't have necessarily to use an electric pump or a manual pump. You can express with your hands. People have done it. It's doable and it's very effective. Actually, I feel like when you express with your own hands, you tend to like remove all the milk than when you do with some of these electric pumps. Hey, a video for another day. Some of these electric pumps need to be disbanded, not to be in the markets, because you still express and you still feel like there's a lot in that breast that could have come out, but it didn't. So yeah, do nurse frequently. Baby is asleep, wake them up. If you feel too engorged after the 2 hours and you can't wait for the baby until the 3rd, you can express. Still milk itakuwa inaendelea kutengezwa, and by the 3rd hour you wake the baby up and make sure that the baby feeds. That is the only way. Remember what I told you about supply and demand. If there's demand, supply will always be there, but if there's no demand, then it's going to definitely impact on the supply. Higher. Number 7, I think, which I already briefly talked about earlier, is ensure proper latching. If there's no proper latching, there'll be no letdown and you'll think that there's a problem, but the problem is there, yes, but it's not because you're not producing enough, it's because you're not attaching the baby well to be able to get the milk flowing. Again, demand vis-a-vis supply, and you'll see that when there's proper deep latch and the areola is attached well, the baby's mouth is attached well to the areola, you can only see a small part of the black part of your nipple, and the positioning is also a very good factor to consider when you're breastfeeding, to ensure that the baby can suck out all the milk, so that again some of it can be produced again, as this thing goes on and on and on. So we had 10 things to talk about, and now we are at our 8th point. And by now, if you've been listening to me and you've been following this video up till now, and you've not yet subscribed, or you've not even commented to say, oh, this worked for me, or I didn't know this new information, or I'll send this to my sister because she just delivered a baby, you've not hit that notification bell yet, what are you waiting for? This is the time. I'm giving you like 5 seconds. Please do subscribe and comment down below, and hit the notification bell before I proceed to number 8, to number 9 and 10. So number 9, you've heard about skin to skin, but most this skin to skin, people who are mostly familiar with this are those who had premature babies, because it is almost like a must when you do have premature babies. When you're still in the hospital, they teach you this thing called KMC, kangaroo mother care, whereas you place your baby on your chest when it's bare-chested, and the baby is also bare-chested, so that you guys can have that contact, like skin-to-skin contact. This helps with bonding, and this bonding helps with your body noting or notifying your body that, okay, we do have baby needs to be fed, and at this point also it relaxes mom and relaxes baby. And as we spoke on point number 1, a relaxed mom produces the most milk. So Do occasionally skin to skin. What I normally advise, because it's something that works for me and I do it myself, I like to do skin to skin while breastfeeding. Oh, it's such an amazing moment. Baby is enjoying, mommy is enjoying. You're feeling the kicks now from outside. She's hitting your tummy with her tiny little feet. You're touching her hands. She's touching the other breast with her tiny little hand. The other one is, the mouth is attached properly to this other breast. You just pure bliss. And in that moment, you realize you're not even thinking about anyone else. Nothing else. Nothing all matters at this point. It's just let the milk flow. Let the milk flow. Yeah. So another thing that people have been talking about, which is herbal supplementation or herbal teas, like you heard me speak about earlier. So the ones that normally work or people have recommended, fennel seeds or fenugreek seeds, which you just boil in water, then have it in your drink. Another thing which I wouldn't call herbal supplementation, but it's basically supplementation, the lactation cookies and lactation drinks that currently are in the market. Personally, I've not tried it myself, so I cannot vouch for any of those, but the fenugreek and the fennel seeds worked perfectly for me. However, even with just hydration, of ensuring that I'm drinking between 3 to 4, sometimes even 5 liters in 24 hours of water, just pure H2O, has totally always worked for me. And the other thing that, this is now just before I recap on the 10th, the other thing that has worked for me effectively, I think, is point number 1 and point number 2. Rest. And I'm grateful for my social support, because other than the fact that you have people who can take care of baby clothes, maybe wash them for you, you can have somebody who can hold the baby while you need to take a nap if you're having a slight headache, or just you didn't sleep well in the night because of having to wake up intermittently to feed. Just the normal social support, or rather I wouldn't call it normal, because I've realized most people don't get that support. But for me, support is what has really ensured that my breast milk supply is on a constant and always on the maximum side, or rather I'm always having a lot to produce. And if I sit in a place for a while, maybe like 2-3 hours, maybe because I left express milk in the house, I start to lactate, and you can just see milk flowing, because my body is tend to is used to me breastfeeding during that second hour or expressing, which, as I said, point number 1 and point number 2 are what have worked for me, and of course the drinking well. If I'm to be asked, I think all of these things have really worked for me, only that most of the time I don't do the herbal supplementation, or any supplementation for that matter. The only thing I do take is my actual supplements, which is vitamin D and other lots of vitamins, that concoction that are for breastfeeding women, and not much of the tea or the lactation cookies or the lactation teas. So stress. You who's stressing because you went through your husband's phone, or your child's father's phone, or because you called your mommy and you asked her to come help you with the child and she's not coming over because she's telling you she also has her own things to do, or you're stressed because your CS incision wound is leaking out, or you're stressing because of whatever reason that it could be that you're stressing, because women, we tend to have stresses almost all the time, but you have to realize that stresses in this world are not going to end. But now you brought forth this amazing little one who needs to be nurtured within you, from you, and there's no other way that they're going to do this without you. Avoid stress. Just completely avoid it. So if there's anything that you know this might be a stressor for you, try to avoid it. How I do it myself after the first 6 weeks, because for us culturally and also religiously, at least for the first 40 days, you're not supposed to be going outside the house, and you're supposed to be indoors and just trying to recuperate and heal. Culturally, your mom is supposed to come, or your mother-in-law, to heat you up, warm you up, massage your body, and make sure that you're up and running by the day 40 when it arrives. But what I do personally to avoid stress is taking walks. Walks have helped me to maintain my health, it has helped me to maintain my weight, and it has helped me to maintain my mental health, which is what you need when you're going through your postpartum phase. Already, there's so many things that could be stressing you from internally, including the hormones that are already raging here and there, your baby who's constantly crying, and if you're I stress on first-time moms because when I was a first-time mom, despite the fact that I was a mom when I was already a doctor, it was still not easy because some things I just can't understand. It's just the same with pregnancy, the way you can just sit and want to cry without you knowing why you want to cry. It happens the same way in postpartum. And sometimes when your baby is crying, it feels like you want to lose your balls and you also want to cry. Your marbles are all over the place and you feel like this is the end and I can't do this anymore. And then we find you in the labor room in 2 years or even 1 year for those who had normal birth or vaginal birth. But that shouldn't stress you. Try to take a day at a time, I say, and you'll see that it will be a beautiful journey at the end of it. They grow up very fast, and that is not a lie. It is actually true. So if you have any questions, comments, or anything nice you'd like to say about this video or just about the channel, please don't be shy. Comment down below and do follow me at Facebook at Dr. Pendo Saru and Instagram as well and TikTok. We have lots of fun there. And ask all the questions that you need. Whichever is within my reach, I'll definitely assist and help. Until next time, love and love.